Hi, this is Chapter 21, Future Trends in Pain Control. So the backbone of pain control in dentistry has always been local anesthesia. And so research is continually trying to find more ways to achieve a longer-term pain control other than just using bupivacaine. Bupivacaine is what they've used, as we've discussed before, on surgeries and for longer acting, even pulpal and soft tissue anesthesia. Soft tissue has been, some say 7, most will say 9 hours. And even it's been reported that they've had soft tissue anesthesia up to 12 hours. So it helps the dentist not give so many prescriptions for opioids since they have become such a problem. So they want to find other things, though, other than bupivacaine. So there's been such an opioid epidemic in the country that it's become really super important for them to do. So this chapter is going to look at 3 different ways. It's going to look at naturally occurring Site 1 selective sodium channel blockers, 2 new local anesthetic delivery systems, and 3 novel adjuvants of local anesthetics. Adjuvant, what that is, it's a pharmacological agent that modifies the effect of other agents. So you could say that epi is an adjuvant to a cartridge of solution, of saline solution and anesthetic, because it modifies the other agents. So paralytic shellfish toxins and is one thing that they have looked at. They are potent neurotoxins naturally produced by pufferfish, shellfish, angelfish, and other sea life. There's a paralytic shellfish poisoning. I can't say that. Shellfish. Okay. Poisoning, which is the ingestion of shellfish contaminated with algal blooms. And those blooms are what is responsible for the red tide that sometimes happens along the coastal lines. And the fact that you can't go out in the ocean anymore until the red tide has moved away. I don't know if any of you have experienced that on vacation. I certainly have. So the neurotoxins, they list them TTX, STX, and Neo-STX. And I would go over those, but I don't think that this is going to be a part of your boards. I think that if you're going to have questions over this, that they are going to ask maybe something that new research is being shown into neurotoxins or whatever. I don't think they're going to list exactly what they are, but just so that you know what they are, they're similar to local anesthetics, and that they're sodium channel blockers but they channel block on the outside pore of a sodium channel. So when we are in the process of blocking a sodium channel, and so that pain doesn't occur during depolarization, so we're going to go way back there. These particular neurotoxins will adhere to the outside pore of one of the channel blockers. And what they do is they interrupt the depolarization of a stimulus or action potential, but they do that for a longer time than normal local anesthetics. Neo-STX is the most powerful or potent and powerful of the neurotoxins. And an overdose of this produces reversible weakness of your skeletal and respiratory muscles, but it is treatable. So what they found was that if they would add this to a cartridge, that even at its worst, if someone were to overdose on this, that it is a reversible situation, and that it's only a weakness of skeletal and respiratory muscles. So that is way different than if it would not be in the cartridge and you would just have an overdose of epinephrine and the local anesthetic, that it could affect, the heart and different areas. So if someone overdosed on this, it would be a way better outcome. So that makes it a little safer, and it makes it super potent. It makes your anesthetic last way, way longer, and it decreases its blood level, resulting in, that's how it increases the potency, the powerfulness of it, and the duration. In fact, it's even longer than bupivacaine. So the duration can be 5 times longer than local anesthetic, especially when it is combined with bupivacaine. The second thing that they're researching and looking at for the future of pain control is a new local anesthetic delivery system. So the new way of delivering drugs they found could be through nanoparticles, liposome microparticles. An example of a liposomal bupivacaine would be Exparel, and it can take hours to deaden, though that's the only problem with it. It takes a very long time for the anesthetic to take hold, and within 24 to 72 hours of lip and tongue anesthesia. So it would never be used for anything that we do, since we have to have it a much shorter onset of anesthesia. But there's still ongoing research. This particular nanoparticles and liposomal particles, they release what they do is they gravitate and just hook on to the properties of the bupivacaine in your system, and they release slow over time. So it's just a little bit given at a time, which is why they lend to lasting for so long, way over, between 24 and 72 hours. So this type of delivery system for a local anesthetic would be mainly for medical. Very rarely would I think it would be used in dentistry, but you need to know that they're looking at such a thing. Then you have your novel adjuvants of local anesthesias that they are experimenting with and still researching. And like I said before, an example would be epinephrine. Could be opioids. Clonidine would be examples of adjuvants that they're looking at. One thing that they've looked at that seems to increase the duration of the pain control is magnesium. They've added magnesium to local anesthetic, particularly bupivacaine, and it has increased the length of pain control by hundreds of minutes. So it has a very low toxicity level, and there's a huge reduction of the need for opioids because it could possibly last for a couple days. So they are looking at these and doing trials of giving placebos to one group and giving this to another group, and hopefully they are hoping that this will lengthen the duration of pain for future procedures. They're also looking at light activated and light inactivated anesthesia, which I think is really interesting. It's called optogenetics and pain modulation. And what that means, it's the ability to instantaneously turn off and on anesthesia, and to specifically targeted precise areas and specific nerves for treatment through the use of different wavelengths of light. And that sounds the best, depending, how they're going to inactivate that. But it holds a huge promise for the future, and would be so nice to be able to um, anesthetize through a light activated or inactivated anesthesia versus giving injections, right?